Hey guys, it's Dr. Rob with your 2-minute tip this week. I want to know, can you squat like this? This is one of the best tests of overall function of your lower body and good basic human movement to actually test, do you move properly? To do this movement, you obviously need to have good range of motion of your ankles, your knees, and your hips, as well as your spine and low back. You're going to notice when I'm doing this, my heels are on the ground, my bum's all the way down, and my spine relatively nice and straight. So what we want you to do is try this at home and see if you can do this. One of the things, I actually had ACL surgery a couple years ago, and for the longest time I couldn't actually do this because of my knee problem. So I worked on it, and when I started to get the actual range of motion back in my knee, I could actually start to do this. And the fun thing is it actually started to clear up any low back tightness. So after a long day of work and my low back's feeling a little bit tight, this is the position I drop down into, hang out like this for about a minute or two, and it's going to stretch and pull and everything. A lot of low back tightness actually comes from tightness and mobility out of the hips. In fact, one of my favorite fun facts is that the incidence or the rate of low back pain in North America is about 80%, which means about 80% of people will experience low back pain at least once in their lifetime. If we go and they did studies in a population of rice pickers in Asia, and the incidence of low back pain in them was virtually 0%. And the reason is when they're working, they actually hang out in this position basically all day. So they have beautiful range of motion out of their hips and their spines. So it's something worth working on, trying to get into this position and being able to do it. So practice this at home. If you're having trouble getting into this position, there's a couple tips you can try to work your way into. Having higher heels like a wedge or a work boot will raise the ankle off and make it a little bit easier to get into this position as well. The other thing you can do is hold on to something to start. So if you can't get all the way down, what you're going to do is hold on to something nice and tight and then lower yourself down as best you can. The natural tendency will be to want to fall backwards. So if you have something to hold on to, you can just kind of lower yourself down. Work your way up. Start by trying to sit in this position for like 30 seconds, then a minute, then a minute and a half, and 2 minutes. Take the squat test, see how you feel. I promise you're going to move better and feel better. If you have questions about it, by all means ask. Your therapist can diagnose and help you get into this position and work on better progressions for you, because if you do this, you will start to feel amazing. Okay? Have a great weekend.